Think your supplements are helping your heart? Some might be silently putting it at risk. Before you reach for that next pill, here are the supplements that could actually harm your heart, and what you need to know to stay safe. Taking care of your heart involves more than just diet and exercise. It also includes being cautious about what you put into your body, including supplements. While many people turn to supplements in hopes of boosting heart health, some may actually do more harm than good. It's important to know that unlike prescription medications, dietary supplements are not strictly regulated. They're often sold without solid evidence of effectiveness or safety, and there's little oversight to ensure they're free from harmful impurities. In fact, some popular supplements have been linked to serious cardiovascular risks. Let's take a closer look at 3 supplements that may harm your heart and why you should think twice before adding them to your routine. Red yeast rice. Red yeast rice is a supplement made by fermenting a type of yeast on white rice. It naturally contains a substance called monocolin K, which is chemically identical to the active ingredient in the prescription cholesterol drug levastatin, Mevacor. Because of this, some people see red yeast rice as a natural alternative to statins. But here's the problem. You never really know how much monocolin K you're getting in each dose. Some supplements contain almost none, while others deliver as much as a low prescription-strength statin. If you're already taking a statin, adding red yeast rice could lead to excessive intake of the active ingredient. According to Dr. Peter Cohen, an associate professor at Harvard Medical School and expert in supplement safety, this can increase the risk of side effects, especially muscle pain or, in severe cases, a dangerous condition called rhabdomyolysis. This type of muscle breakdown can damage the kidneys and other organs, making it a serious concern for your heart and overall health. L-arginine. L-arginine is an amino acid that your body uses to make nitric oxide, a compound that helps relax and widen blood vessels. Because of this, L-arginine supplements are often marketed as a natural way to improve blood flow, lower blood pressure, and even support sexual health by promoting stronger erections. However, for people with heart conditions, L-arginine can be risky. In fact, one major clinical study looking at heart attack survivors had to be stopped early because several participants taking L-arginine died. This raised serious concerns about the supplement's safety in individuals with cardiovascular disease. L-arginine can also interact poorly with common heart medications. If you're already taking drugs to lower your blood pressure, the supplement may push it too low. For those on blood thinners, it could raise the risk of bleeding. And if you're on ACE inhibitors, a common treatment for high blood pressure or heart failure, L-arginine might cause your potassium levels to rise dangerously high. For these reasons, L-arginine is one of the supplements that may harm your heart, especially if you have an underlying condition or are taking heart-related medications. Always consult your doctor before adding it to your routine. Garlic supplements. Garlic has long been praised for its potential health benefits, especially for the heart. Many people take garlic supplements hoping to lower cholesterol or manage blood pressure. But despite the hype, research has shown mixed results. Some studies suggest garlic supplements, whether made from fresh garlic, aged extract, or dried powder, may have a modest effect on lowering blood pressure. However, the evidence around cholesterol-lowering benefits is less convincing. What's more important is that garlic supplements may carry real risks, particularly when combined with heart medications. Garlic can interact with blood thinners and increase the risk of bleeding. If you're taking cholesterol-lowering drugs like statins, garlic might raise the chances of muscle damage. And if you're on blood pressure medication, garlic supplements could cause your blood pressure to fall too low, leading to dizziness or fainting. While garlic in food is generally safe and even heart-healthy, concentrated supplements are a different story. They're one of the supplements that may harm your heart, especially when combined with other treatments. It's essential to talk with your healthcare provider before adding them to your regimen. Calcium supplements and heart health. Calcium is essential for more than just strong bones. It also supports healthy teeth, nerve function, blood clotting, and even heart rhythm. For adults over 50, the recommended daily intake ranges from 1,000 to 1,200 milligrams. Fortunately, many people can meet most of their calcium needs through a balanced diet that includes foods like dairy products, leafy greens, calcium-fortified orange juice, canned sardines or salmon, almonds, tofu, and winter squash. If your diet falls short, a low-dose calcium supplement, typically around 500 milligrams, may help fill the gap. But when it comes to heart health, calcium supplements have sparked some debate. Over the past decade, headlines raised concerns about a possible link between calcium supplements and heart attacks. However, more recent reviews by leading health organizations, including the National Osteoporosis Foundation and the American Society for Preventive Cardiology, found no strong evidence connecting calcium supplements to increased risk of heart attack, stroke, or early death. That said, more isn't always better. Taking too much calcium, especially from supplements, can lead to hypercalcemia, an excessive level of calcium in the blood. This condition may cause nausea, confusion, and even neurological symptoms. High intake of calcium supplements has also been associated with an increased risk of kidney problems and, in men, a possible link to aggressive prostate cancer. While calcium supplements aren't clearly among the supplements that may harm your heart, it's still wise to approach them with caution. Stick to the lowest effective dose, prioritize calcium-rich foods, and always talk to your healthcare provider before starting a supplement regimen. Always talk to your doctor before starting any new supplement. It's essential to know whether it's truly necessary and if it might interfere with any medications you're currently taking. For more science-backed, trustworthy health content, subscribe to HeInfo, your all-in-one destination for expert-guided health tips and clear, compassionate education. Stay informed, stay healthy, stay empowered.